The one thing people need to know today about healthcare in the U.S. is that per capita spending on individuals over age 65 is 3 times as high as for individuals working age. And the number of individuals in the U.S. over age 65 will double over the next 40 years. Medicare and Medicaid pay for most of that healthcare spending. The traditional fee-for-service Medicaid benefit structure needs reform. It does not give incentives for value-based choices in care. Both parties agree that reform is needed. However, the current political environment suggests that actually passing Medicare reform will be challenging.
We spend $3 trillion on healthcare. That's 3 with 12 zeros after that. That's a huge amount of money. And I think the way to control healthcare costs is getting the incentives right. And there are 2 ways to doing this. One is giving the incentives to consumers or patients and giving them more skin in the game and saying, if you make the right decisions, make smarter decisions, you will save some money. The other way to do this is to incentivize hospitals and doctors and healthcare providers, and basically saying, if you make the right healthcare decisions on part of your patients, you will earn more money. And I feel the latter approach is the right approach, giving the incentives to physicians and hospitals to save money to make more cost-effective healthcare decisions is the way to reduce the $3 trillion in healthcare spending.
The one thing that people need to know about healthcare today is that the administration and Congress need to provide clarity today about whether they're going to fund the cost-sharing reduction subsidies and strongly enforce the individual mandate. Insurance marketplaces can't be expected to function in a world of heightened political uncertainty. And if this type of clarity isn't provided, then insurers will have to raise premiums considerably, which will increase federal spending, or they'll pull out of the market entirely, and people will be left with no options in the individual market.
The one thing people need to understand about healthcare is that if our goal is to improve population health, then healthcare is not really the answer. A lot of things affect the health disparities that exist in this country. They have to do with early childhood education, nutrition, diet, exercise, and they are things that are malleable with public policy, but they may not involve giving direct services like doctor visits and things like that. Look more broadly at population health, not just healthcare.
I'm extremely proud of the quality of the expertise of our faculty and students in health policy and economics in the Price School. We have one of the very top health policy centers in the country in the Schaeffer Center for Health Policy and Economics. And we also have an outstanding master's in health administration and an undergraduate concentration in health policy and management. Our faculty in the Schaeffer Center and in the Price School publish in some of the very top journals in the field, helping to shape thinking and the future of the theory and the knowledge about healthcare policy and economics. But they are also very actively engaged in influencing the policy debate by giving testimony, by writing op-eds, and through their Schaeffer Center partnership with the Brookings Institution, and helping to influence reform in the United States as well as around the world.